seeing that coconut oil pulling is said to be good for your teeth. It can reduce inflammation, help with dry mouth, remove harmful bacteria from your mouth, combat cavities. It can even whiten your teeth. Hi everyone, my name is Whitney and I'm a dental hygienist here to talk about whether or not oil pulling is beneficial. First off, what is it? Oil pulling is where you take coconut oil, which is solid at room temperature, and put it in your mouth. You don't eat it, but instead your body's naturally warm temperature melts the coconut oil into a liquid, and as that's happening, you essentially pull the coconut oil around in between your teeth, similar to the way you would if you were swishing mouthwash around. However, while it might seem safe, since it's coconut oil, a pretty natural thing, right? There are some oil pulling dangers you need to be aware of before you ever try this. Oil pulling danger number 1. If you have TMJ issues, jaw trouble, don't be trying this. Oil pulling can really do a number on your jaw since the benefits of oil pulling, which we'll talk about in just a second, tend to require at least a good 20-minute swishing session. 20 minutes of back and forth. That's a lot of strain on your jaw joints. And that's the number 1 negative side effect. Jaw pain, joint stiffness, and even headaches and neck pain because of the tension spreading onto the adjacent muscles. The other danger is not a danger to you, but a danger to your house. Oil pulling can severely clog your sinks and pipes. So just like you wouldn't want to pour grease down the sink, you shouldn't be spitting coconut oil down the drain either. If you are going to oil pull, be sure you spit into the garbage. Okay then, so what are the benefits? Why are people doing this? And before I even talk about the benefits though, I really need to make it clear that oil pulling is not meant to replace brushing or flossing. Just need to say that before we get into this. Oil pulling should only be used to enhance your tooth and gum health, not to replace anything. It's just like mouthwash in general. Just swishing with something won't ever physically remove plaque that's stuck on your teeth. Only brushing and flossing can physically remove plaque, right? So if a regular mouthwash can't do it, we really shouldn't expect anything different from coconut oil. And that's why, as of now, there really isn't any firm, extensive evidence to show the benefits of oil pulling. All these oil pulling benefits I'm about to go over are based off of extremely limited research. Yes, the little bit we have may suggest that there could be potential benefits, but it just isn't enough for dental experts or the American Dental Association to professionally endorse it. So with all of that being said, let's start with the first claim, whitening. Some people say that oil pulling makes their teeth appear whiter. While it isn't necessarily any type of whitening agent or bleaching agent, the oil might help buffer stain prevention, which is why you might feel your smile look brighter. But also lots of people feel their smile looks brighter simply after brushing them as well, so it can't hurt to try it, but it will if you have jaw problems. And next up, depending on who you ask, some people also swear that oil pulling combats tooth decay because it may help reduce bacteria inside of the mouth. It's cool, I've seen some studies about this, however, you have to read that claim carefully. It may help reduce bacteria to prevent tooth decay. While reducing bacteria, unfortunately, is not the only thing you need to combat tooth decay. Remineralizing tooth enamel is what really prevents tooth decay. And we don't have any evidence that there are any properties inside of coconut oil to remineralize enamel, so I don't know about that one. But talking about removing harmful bacteria, there is scientific research that shows oil pulling being associated with lowering the number of harmful bacteria inside of the mouth. And from the one study that I found providing this statement with sufficient evidence, participants actually used sesame oil for oil pulling instead of coconut oil. And although yes, again, with the way that it's worded, the harmful bacteria was lower after oil pulling, it wasn't eliminated. Oil pulling didn't remove this harmful bacteria like brushing and flossing does. So really, 20 minutes of oil pulling to maybe reduce bacteria, or 2 minutes of brushing and maybe 1 minute of flossing to for sure get rid of it. I don't know. Next up, gum inflammation. There have been a few studies that were performed comparing chlorhexidine rinse, which is a prescription mouthwash, and coconut oil, and scientists found a similar reduction of gingival symptoms. This one was actually a super promising finding, especially since chlorhexidine can cause tooth staining if you use it for more than a couple of weeks, so that's cool. Coconut oil doesn't stain, but still, this is a pretty specific comparison since not that many people get prescribed chlorhexidine, and also, even if this is you, switching with chlorhexidine takes less than a minute to do each day, while oil pulling requires switching for ideally 20 minutes at a time. So I still don't know. I would just be more worried about your jaw in this case. Too much swishing, that'll hurt. But lastly, let's talk about dry mouth. Of course, oil pulling is likely to be a great help with dry mouth since coconut oil is a natural moisturizer. It can aid in alleviating chronic dry mouth symptoms, including dry or sticky tissues in the mouth, as well as cracked chip lips, just like you would rub it on your skin when you have dry skin. I'm down for this one. In all, although there is potential to say that coconut oil pulling helps whiten teeth or help combat tooth decay kind of, or treat gum disease and inflammation, I'm okay with that one. There still needs to be more reliable testing on a larger data sample for all of these, as well as more in-depth research to understand the actual mechanical reasons behind it. So for now, the words may, can, and could seem to be needed for nearly every oil pulling claim. But if you really want to try it at home for whatever reason, sure, it can't hurt anything except for your jaw and maybe your plumbing. So don't do it if you have TMJ issues, and don't spit it down your sink. And if you're going to try it, just remember that all this research that we've read, it all alludes to that it needs to be at least a solid 20 minutes of swishing for it to be effective. So don't be wasting your time and only swish for 30 seconds daily. I would assume nobody wants to be wasting their time. But again, if you really like it, it makes you happy, you do you. And if you remembered anything from this video, just remember that oil pulling definitely does not replace the mechanical removal of plaque. You still need to brush and floss to remove bacteria and debris from your teeth to properly prevent both tooth decay and gum disease. Oil pulling is just an added benefit that you are welcome to add to your routine if you really want to, but please remember, don't do it if you have a sore jaw. How many times can I say that? I hope this video helped you. Please like and subscribe and turn on your notifications if it did. And until next time, I'll see you on Instagram at Teeth Talk Girl. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com. Peace, love, and teeth.